why we brush soon after eating something sweet, because in the first 20 minutes after you've eaten something high in sugar, that's the highest production time for those
what
bacteria.
is so sad nowadays actually is a lot of juices actually have high concentrated sugar in them.
Yes, they do. So we recommend whole fruit. Whole fruit is much better for you from a dietetic standpoint, but also from a dental standpoint.
Good. We have Sue on line one. Sue, good evening.
Yes, I had a question for you. It's because we have a friend that his teeth is just pitch black. And he goes through like a 5-pound bag of sugar a day.
Wow.
It's a lot of sugar.
And I was wondering, you guys was talking about decaying and everything, and his, we try to get him to brush and everything, and he won't do it.
How old is he?
He's 50.
50.
Yeah.
Goodness. And what is he wanting to do about this?
He ain't doing anything. It's just getting worse.
Does he still have his teeth?
Part of them.
One thing that would be a concern is that he is at risk for a large degree of dental decay, and that decay can lead to infection.
Right.
Toothaches are a sign of infection for the most part. Most toothaches will be an infected tooth, and that infection can spread throughout the body. So you want to get on top of those things. That's why we preach prevention, and we want to get on top of toothaches, because we don't want that infection to spread throughout the body and cause a more serious problem. So that is something that he may want to consider having looked at. It would be very, very much in his best interest to have his teeth looked at and make sure that at least he's not having any infection if he's not worried about the cosmetic concerns, that for his own health. The teeth are part of the body. They are an organ. So when they decay and become infected, they can infect the rest of your health.
Sure.
Yeah, that's the reason I was wanting to find out, is because he's got a knot that's coming up on his back. And the doctor at the hospital wanted to drain it one day, and he refused him to doing it because he said nobody was going to cut on it.
Wow. That's tough.
That is tough.
That's tough.
Well, you're a good friend to encourage him to take care of himself, but in the end, we all have to do what we can to take care of our own health, and he needs to know that you want him to take care of himself and keep encouraging him.
Yeah, but it's hard when he's already, made his set mind, what he wants to do. You can't really, keep forcing him.
Right. I
True.
think he's 50 years old, so it's kind of hard.
Yeah.
Well, do your best, ma'am. Okay, thanks, Sue.
Thank you.
Good night. We have Swede.
Hello there. Yeah, this is old Sweet.
How you doing, sir?
Well, any better I couldn't handle.
Good. What do you got for us?
Was I've been on the line.
Okay. You got a question?
Well, I got a little bit of something of interest to the dentist doctor.
Okay.
I'm well into my good luck year after I celebrated the Diamond Jubilee and then the 76 like the country did. So, but about 6 or 7 years ago, I started, my dentist doctor, was telling me, he says, Sweet, what the heck are you doing? He says, I can't hardly keep up with your teeth decaying. I says, I haven't changed my routine. I still got a sweet tooth to some extent, but no different than what first started with you years ago. So anyway, I happened to be looking at the health section in the Eagle, and there was about a 3-inch little article in there that stated that anybody taking an antidepressant pill would contribute to causing your teeth to decay. And I was wondering if you'd have any knowledge on that. Now this happened, and I eventually had to have them all taken out and got plates. But so when I read that article, I took it in to see my dentist, and I asked him if he'd heard from my lawyer that morning yet.
Oh, no.
And he says,
Wow.
No, should I? I says, well, here, read this and then see if you should have or shouldn't have. So he read it, and he says, you know what, he says, it's been a long time, he says, but I did hear people talking about that. He says, but in some way or another, it slipped by all of us or whatever, and we don't really mention that to our patients. I said, well, you can hang on to that so you don't forget it anymore. And, but the reason I calling was if there's any truth in that, which, as far as I'm concerned, there's truth in it, that it'll cause the teeth to decay. It's bad enough getting older or whatever without contributing something else to it.
Mm-hmm.
But at least I sleep like a baby at night.
That's a
And
good thing.
That
Yeah,
was
that's
the main
good.
thing for me. And when the daughters were getting old enough to brush their teeth, what would you think of a father that said, okay, if you guys don't brush your teeth properly, this is like when they're about 5 or something like that, get a little bit older, and had one, and middle daughter, she was kind of stubborn. So I'd waltz her in there, and I'd say, okay, have me one of them little cups there. And I'd pour full strength peroxide in the cup. And I said, now, you go ahead and take a little bit of that and then brush your teeth. And I'm going to stand right here. You know, it didn't take very long that she started. And then she got lazier as she got older. And within the last 10 years, I wouldn't have wanted to see her dental bill. Because she said, well, I guess I'm on my own. Don't have to. But, and I got chastised a little bit for that, for being too mean to have a father, to have my daughter take peroxide out of the bottle, put it in her mouth. And she says it didn't taste good. So I thought I'd call you and see what your words would be on doing either one of them. Well, number one, the antidepressant pill.
Mm-hmm.
I think that really is something that probably a lot of people out there are running the same route that I did, and they found out they may surprise their dentist.
We'll go ahead and address this issue with the doctor, Swede.
Pardon?
We'll go ahead and address this issue with the doctor in a few minutes.
Oh, okay.
Okay, I appreciate it.
I appreciate you guys allowing me to have my say.
Anytime, please. Thank you, sir.
Absolutely.
Thank you.
Any truth to that?
Well, the connection there is not that the antidepressant itself causes the decay. A lot of the medications we take today cause dry mouth, and
I
that's
see.
something that people in general need to be very aware of, that dry mouth causes a decreased saliva in the mouth, and you need to be very careful that you're hydrating the mouth, because
see.
saliva is protective. It helps keep that acid. Basically, it helps counteract the acid. It has base in it that will help neutralize the acid. So if you are lacking saliva, it makes eating more difficult, but it also makes your decay rate go up because you're not getting that protection. So the acids and such are more likely to decay the teeth, and we do see that. We see it in cancer patients who've lost the function of their saliva glands. It normally comes to the attention of a dental professional or a doctor when the patient complains of the dry mouth. So there is a connection there, but it's not a direct connection that the antidepressants themselves cause decay. It's their effect on the body that some people who take antidepressants do have dry mouth, others don't. So it's, you know, there's lots of medications, but if you notice that dry mouth is a possible side effect of any medication you're taking, you need to take the steps to keep your mouth moisturized. You can do that by sipping water throughout the day. If you have a more severe problem, you can use products that are such as saliva replacements. Biotine is a good brand, and they have different mouth moisturizing toothpaste, gum, other things of that nature. If you notice that you can increase your saliva production by sucking on something like a piece of candy, make sure that that candy is sugar-free, because a sugar candy that you're using to stimulate saliva is still going to give that bacteria acid or food to make into acid. So you really need to be careful and use the right things and use healthy things to keep your mouth moist.